Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today my topic of discussion is about systemic lupus erythematosis and its associated retinopathy. If we talk about SLE, it is basically an chronic autoimmune connective tissue disorder affecting multiple organs in the body, and it has a recurrent or a relapsing course. Most of the patients, up to 90%, are the females affected with this disease, and it can affect any organ in the body. But once it involves the eye, the most common is the dry eyes, and after that it can also cause the retinal involvement. Now, once the retina is involved in these patients, this is a very accurate sign of the involvement of the eye, systemic activity, very accurate sign, which may be overt or hidden. Yes, and the other thing is that the retinopathy involvement in the SLE has very important role in the survival rate of the patients. So it has got also its significance if we talk about the prognosis and its ultimate life survival. If we talk about lupus retinopathy, it is an immune-mediated vasculopathy, and it may cause microangiopathy. It can cause microvascular occlusions or vasculitis. All these things can happen in this disease. Apart from this, we will find typical features like cotton wool spots, fine hard exudates, dot hemorrhages. All these features, as we find in other vascular diseases, these are prevalent in these patients. Even if the patient has on examination, there are no vascular abnormalities over there, we can still find out some hypopigmented patches over there. Yes, these patches are basically can be appreciated later on in the fluorescein angiography as extensive areas of absence choroidal filling. Apart from fluorescein angiography, the OCT is very important in the diagnosis. It shows us subretinal fluids, intraretinal fluids. Apart from this, it can also show us a pigment epithelial detachment. So OCT is a very important tool in diagnosis and the management of these patients. As it is shown in this image slide, you can appreciate over there is a subretinal fluid over there in the macular area. Talk about even in the subclinical cases in which the disease is not very active, angiography will help us to locate the microaneurysms, the capillary dilatation, and the leakage of blood vessels. All these things which are shown in this patient in the slide, you can see that it is getting leakage over the different areas. Talk about the choroid. It is also can be seen on the fluorescein angiography. We can see the areas of subretinal leakage, pulling of the dye over there, delayed choroidal filling, especially if there is a serous retinal elevations over there. So all these things can be appreciated over there. So basically, lupus retinopathy and choroidopathy can also be evaluated with this fluorescein angiography, although indocyanine green angiography has also a role in this diagnosis and management. Talk about this, the severity, it may be mild to moderate changes to severe blinding conditions over there, and usually retina is involved in 10% of patients with SLE. As I earlier mentioned, you can find any type of lesions over there, cotton wool spots, hard exudates. You can have their arterial or narrowing over there, attenuation at the arteriovenous crossings over there changes. You can have macular pigmentary changes, macular ischemia over there, subretinal fluids. All these things are happening because of this disease over there. We are talking particularly about lupus retinopathy, so multiple treatments can be done. For example, the systemic steroids, they can be used over there. Anticoagulants have their own role. But as it is an ischemic retinopathy, different areas of ischemia are developing over there. So we know whenever there is ischemia over there, there is a chances of developing new vascularization and all these hemorrhages. So laser photocoagulation has a role in its treatment. So systemic lupus erythematosis is basically a multi-organ disease. So it needs subspecialties to act and treat this disease. For example, dermatology, nephrology, rheumatology, and ophthalmology. They all have to work as a team to control this disease. As I mentioned earlier, systemic, we can start with the non-steroidal anti-inflammatory drugs. We can use hydroxychloroquine in the management of SLE, along with this one subtenolone. We can be used over there. But if we talk about the biologic agents, we have got azathioprine, mycophenolate mofetil, cyclophosphamide, methotrexate. All these can be used in consultation with rheumatology department. But once the retina is involved, it also shows that inadequate control of the whole disease process. Yes. So today I wanted to discuss with you about SLE, which is still very much prevalent, basically in females disease, and its clinical manifestation, particularly stressing upon the retinopathy. Yes, lupus retinopathy, its leakage, its role of lasers over there, how it can be controlled. I want to thank my respected audience for their attendance and attention. I hope it will be beneficial for their clinical practice. Thank you.